my name's Henrietta Hood and I'm a carer for my mum. She's been diagnosed with motor neurones disease, and we've spent a lot of time, probably the last 4 years, going in and out of hospital and learning all different things about the disease. As she has declined, her mobility has got less and less, and so the need for understanding pressure injuries has increased.
In the emergency department, we have the unique position to be able to assess our patients and implement pressure injury strategies. We do this through risk assessments and clinical judgment and head-to-toe assessments. We then partner these strategies with the patients and the families to reduce their risk of pressure injuries.
I'm the wound care CNC, and at our facility we work as a team to reduce pressure injuries. We identify high risk patients like older adults, the critically ill, surgical patients, palliative care, end-of-life patients, spinal cord injury patients and people with medical devices. We then put in early interventions to reduce the risk of pressure injury.
In ICU, patients are at high risk of developing pressure injuries because they are immobile. We check devices attached to our patients, we check their skin, and we regularly reposition our patients as well.
We like to talk to our patients and families about how we can prevent and reduce their risk of pressure injury. For example, we like to talk about ensuring our skin is kept clean and dry, and the use of barrier creams to ensure our skin integrity is kept intact. It's important to us that our patients and families have input into their strategies to ensure their preferences are considered.
Device-related injury is the most common cause of pressure injury in paediatrics. As nurses, we regularly check the skin under and around these devices and equipment as part of our routine care.
Care teams perform daily rounds, which encourages patients and their families to be involved in their care. Our team does hourly rounds to ensure that the patients are comfortable. We tend to their bathroom repositioning and pain requirements.
There's a strong link between nutrition and pressure injuries. So for people who are identified at risk of malnutrition, we get involved as the dietitian. So we help people to eat as best they can, get enough energy and protein to meet their needs, enough vitamins and minerals, and if we need to, we might use a nutrition supplement.
As an occupational therapist, we provide equipment to patients on the ward and also look at equipment that might be required in the community. We also provide education to nursing staff and also the patients around pressure area relief and exercises to help with their pressure care. We can implement anything from things like mattresses, pressure cushions, specialised seating equipment to heel protection and lots of other equipment that might be required.
As the physiotherapist, we encourage early mobilisation for pressure area care to increase circulation, get the blood moving, get people up and walking.
So we were lucky to have met so many different people, and without that information I wouldn't have been able to provide the correct care for my mum and make sure that she hasn't had a pressure injury.